Good evening and thank you for waiting patiently. We will start the webinar in a few minutes. We are waiting for the other participants to join and then we will start the webinar. Thank you very much.
Good evening, everybody. I'm very glad to welcome all of you for the first webinar of the International Eye Care Alliance, ICA. I'm Mrs. Leena Nair, the Executive Manager from Zamindar Microsurgical Eye Centre, Bangalore. This webinar is happening in collaboration with Indian Optometric Association, MS RAMAIAH University of Applied Sciences, and Zamindar Microsurgical Eye Centre, Bangalore. We are all come together today to collaborate between ophthalmologists and optometrists. There is a lacuna always between these two groups of professionals, and ICA has taken leadership to bridge this gap. And of course, the end goal is to eliminate avoidable blindness. I would like to introduce Dr. Samina Zamindar as she will be starting the session. So over to you. Samina Zamindar is the founder and Chief Medical Director of Zamindar Microsurgical Eye Centre, Bangalore. Over to you, Samina.
Thank you, Leena. And I once again welcome each one of you to the very first webinar of the International Eye Care Alliance. This alliance is being founded by myself, Mr. Avinash Prabhu, who will talk after me, and Mr. Rajiv. Dr. Namrata Sharma, Dr. Mohita Sharma, and Dr. Pradnya are the patrons for this alliance. And together we want to bridge the gap between ophthalmologists and optometrists. Our aim is to eliminate avoidable blindness. And I now am going to share my screen. Just give me a few seconds. Leena, is my screen visible?
Yes, it is.
Thank you. So today, optometrists are the new leaders in eye care. And ideas always emerge in a dialogue. So this webinar starts a dialogue between optometrists and ophthalmologists. Together, we can do a lot. I personally have been very vocal about the role of optometrists in this lofty mission of ours. So, eliminating avoidable blindness with optometrists as our strong partners. This is what we aim at. The International Association of Prevention of Blindness latest vision report says that at least 2.2 billion people live with vision impairment. Refractive errors, 123.7 million people have unaddressed refractive error. 826 million people have unaddressed presbyopia. 66% of blindness is caused by untreated cataracts, and 65.2 million people are visually impaired due to cataract. 6.9 million people globally have vision loss from glaucoma, and 3 million people are losing vision due to diabetic retinopathy linked to uncontrolled diabetes. So the scope of my talk is divided into two parts: the role of optometrists in improving clinical excellence in eye care and improving process excellence in eye care. Clinical excellence. What role does our optometrists play in improving clinical excellence in any eye care organization? They lead in precision in all our ophthalmic investigations, be it photography, tonometry, field analysis, or any form of scans. They lead in initial assessment, picking up a pupil abnormality, an RAPD, an iris neovascularization, a shallow anterior chamber. All our optometrists are very well trained to pick up these things even before we think about dilating them for further evaluation. Leading in biometry, Today, cataract surgery is a refractive surgery. People want independence from glasses. A precision-based cataract surgery is not enough. Our optometry team, our biometry team has to be trained and ready to give precision-based intraocular lens calculation and give us the best uncorrected visual acuity of 6.6 N6 if your patient wants it and if your patient is suitable for it. So low vision aids is another area wherever a patient's vision cannot be improved with all our clinical expertise and any form of surgeries, we still have a hope and still give some functional vision to our patients through low vision aids. Who takes leadership here? Again, our optometrist. Vision therapy. In today's world where uh, vision is plays such a critical role in looking at digital devices, vision therapy is very, very important. Myopia is the next pandemic after COVID, and all our optometrists at Zamindar Microsurgical Eye Centers are leaders in myopia care. Holistic advice, holistic counseling is very, very important. And it starts from the first ever interaction with our optometrist. In opticals, again, there are varied form of options of lenses available, including those for myopia progression. And a very well-trained optometrist can dispense the glasses beautifully. Dry eyes is another major area of problem with people continuously working on screens and the environmental hazards of pollution, etc. Dry eye has become a big problem. Again, empowering our optometrists to run independently dry eye clinics is something what we need to look at. Public eye health is definitely our end goal. Involving and engaging the community so that they come forward for preventive eye checkups. Now, this kind of awareness and counseling begins from school. So, school eye checkups and community eye care screening is where optometrists again take a leading role. These all duties are beautifully accomplished by the robust team of optometrists. Again, home eye care services. People who cannot come to you, you go to them and deliver the best care at home. So, besides all these areas of clinical excellence, research is another area where optometrists take a leading role. Patient-reported experience measures is something which we carried out as a research project at Zamindar Microsurgical Eye Centre, and our optometrists are playing an important role in data collection, not only in this research, but data collection in all our key performance indicators throughout the organization. They are the backbone for any such new initiative which we take at our centers. So that the first part of my talk spoke about excellence in clinical areas, and now I speak about excellence in process. What was this first requirement in a hospital? That it should do the sick no harm. Florence Nightingale told us long, long back that the very first requirement as a hospital is that it should do the sick no harm. And errors are very, very common. Doctors can make errors, optometrists can make errors, any staff of the hospital can make errors. But your optometrists, because they know the fabric of your organization, they can help us reduce errors. Our optometrists are the ones who have made these beautiful checklists. In fact, we don't call it checklist, we call it the do not miss list. You can see such beautifully written in do not miss in optometry, systemic history, ocular history, tagging certain patients, refraction, and attaching the old records. Incident reporting culture. After all the precautions what we take at our organization, an adverse event can happen. Now, a pervasive fear of negative consequences affects the event reporting rates. But if you have a culture like an adverse event reporting culture. Your optometrist can take leadership in reporting adverse events, at least in your OPD areas, whenever such an event happen. And an adverse event is not just actually when there is a harm. An adverse event reporting or an incident reporting culture is also about reporting near misses. The harm was going to happen, but it did not happen. And no harm. You missed. All these small incident reporting culture is very, very important for us. And who better than our optometrists to take leadership in helping us make an incident reporting culture? Our optometrist, in fact, she is our the head of our optometry and biometry. She heads our facility and equipments also. So you can imagine every area of safety is taken care of by the optometrist. Lucien Leap told us long back that incompetent people are at most 1% of the problem. The other 99% people are good people trying to do a good job, who make very simple mistakes, and it's the process that sets them up to make these mistakes. So together, the optometrists and ophthalmologists can make robust systems so that mistakes do not happen. We cannot blame the individual. We have to blame the system. And together, we can make stronger systems. These are some pictures of our standard operating procedures, brainstorming meetings where you can see people and optometrists and our other staff interacting and sitting together. Leading in counseling, the doctor has only that much time, but it's the optometrist who takes it forward and does the counseling for our patients. So communication at all level, doctor to patient, staff to patient, optometrist to staff, medical records, all these area, how to communicate with elderly patients, how to communicate with children. These soft skills are taught to the optometrists and they work beautifully in tandem with our ophthalmologist. Regular training and interaction with ophthalmologist is a common sight. So quality, again, optometrists play an important role in our quality committees, in our KPI, key performance indicator meetings, in our rapid response teams like the code red and the code pink teams, in the CPR teams, and even handling medical emergencies. In the outpatient department, the first point of contact between a hospital and the patient is the optometrist. So you can see here that human resource related errors can be reduced by the optometrist, equipment related errors can be reduced by the optometrist, process related errors can be reduced by the optometrist. Standardization, empowering, training, and respecting the optometrist team in your organization is the only way you can get complete patient satisfaction. A happy and a respected team of optometrists is the backbone of any successful eye care organization. Thank you very much. I now stop my sharing over here. And I request Leena to take over.
Yeah, thank you, Dr. Samina. Now I would request Dr. Avinash to start with his presentation.
Yeah, thank you.
Over to you, Doctor.
Thank you, Ms. Leena. I'm just sharing my slide. Give me a minute. Is my slide visible?
Yes, very much visible.
Yeah. So, good evening, one and all. At the outset, I would like to thank Dr. Samina and Dr. Rajiv for this initiative. And like-minded people come together, and that's where the result is really good when it happens, when that kind of a collaboration happens. And especially, I would like to thank Dr. Zamina for giving a very comprehensive presentation about the role of optometrist in the existing clinical setup. And I think you have covered up most of the important points that, as an optometrist, which we should have covered up. So thanks to you, ma'am. And we know that you are a very strong professor the uh, of this kind of a qualification of an optometry, and it's very rare that we find this kind of like-minded ophthalmologist in this field who do appreciate the role of an optometry. So we are thank you once again to that. So my top today is on how do we integrate patient safety into optometry training. So that's what I'm going to talk about. And I'm presently associated with RAMAIAH University of Applied Sciences, and I have a short presentation. I'd like to put it in front of all of you. Moving on to the next slide, I hope it is moving. Patient safety is not just an adjunct to clinical competence, it is a foundation of it. So that's how it has been mentioned in the almost all the publications of WHO, that's World Health Organization. Now, patient safety is a very core professional value. It's kind of a professional value, or it's a professional virtue, and it converges with education, clinical practice, and ethics. And most importantly, it is a lifelong learning competency which everyone has to adopt over a period of time. And today I was just going to this, preparing this presentation, and I was very much shocked to look this two articles which has been published in one of the renowned journals, international journals. And I was shocked to know that around 25.5% of misdiagnosis do happen by an optometrist in an emergency eye care, and also around 51.8% of indirect diagnosis happen in a primary healthcare setting by an optometrist. So this is really an alarming kind of an percentage that is reported in the paper. And but most of these two papers are an international paper, so we couldn't get very specific on the Indian journal paper on this kind of a on this kind of an prevalence or a percentage. But it actually gives a kind of an idea, or it rings an alarm that we as an optometrist somewhere, I think we are lacking few things, which is leading to this kind of an emergency issues, misdiagnosis, and this kind of incorrect diagnosis in the eye care fraternity. Now, why patient safety matters in optometry? Now, optometry is expanding role in primary eye care and chronic health disease monitoring. The growing burden of visual impairment and the need to address it. So that's where I think as an optometrist, the profession of an optometry is evolving over a period of time. And there are rising complexities of optometric practices because now we have a lot of AI devices coming into the picture, a lot of advanced diagnostic coming into the picture. And I think the complexity has increased over a period of time, maybe past 10-15 years. And most importantly, if there is an error in an eye care related intervention, then it can lead to an irreversible visual impairment, where I think the importance of patient safety is very, very important when it comes to the profession of optometry. Now, what are the common patient safety risks in optometry? Here are few of them. I just summed it out. We have infection control breaches, like when we dispense a contact lenses or when we do an instrumentation, there is an issue. And there is an equipment calibration and interpretation errors which gives us a wrong value, and there probably could be diagnostic errors as well. And most importantly, which we do often find in this cohort, is communication failure and documentation lapses. So I think these are some of the very critical patient safety concern issues when it comes to the profession of optometry. Now, I could list down around 9 to 10 of them, how we can mitigate this kind of issues when it comes to the profession of optometry. And here are them. So the first one, clinical risk assessment and error prevention. So as an optometry or as an optometry student, he or she must be trained to identify and mitigate some of the risks during an optometric care proactively. For example, when you're doing a refraction, or when you're performing a contact lens fitting, or when you're doing a binocular vision therapy or a low vision care therapy, I think you should make sure that this kind of risks are mitigated to a maximum extent. Secondly, common adverse events such as missed pathology, incorrect prescriptions, poor infection control. I think this also needs to be taken care of. Then there should be some safety checklists and standardized clinical protocols in the clinic. And also, this structured risk assessment should be there in order to prevent this kind of diagnostic and procedural errors, which are very common, which we see in the clinic. Secondly, IPC, infection prevention control. This should be reinforced as a patient safety cornerstone. And here are a few of them, like disinfection and sterilization of diagnostic instruments when we use, for example, a tonometer or a trial frame, and also the chin rest of a keratometer or maybe a slit lamp, and hand hygiene compliances when you do a contact lens fitting, and again patient education for contact lens fitting. And most importantly, if we can plan some kind of a simulation based kind of an IPC training as a preclinical exposure to our students, probably that would turn out to be a very important training protocol for our students, wherein they can do well when it comes to real-time patients. Third, foundations of patient safety science. So this should be formally inducted in the curriculum. Uh, uh, as of now, we don't find this kind of subjects being inculcated into the curriculum very specifically, though there are some bits and pieces here and there. But I think this is something that has to be taken into consideration. Fourth one, safe of use of diagnostic safe and therapeutic technology with clinical reasoning. For example, students should learn or develop this kind of competencies wherein they can safely operate in OCT, perimetry, fundus imaging, automated refractors, and they can identify the artifacts. They can identify the false positives, false negatives in a visual field report, and they should be very careful with the data. They should be very careful with the they should be very careful with the data integrity and secure handling of digital patient records and recognition of red flags. I think when it comes to the diagnostic reports, I think that's where I think our optometry faculties or optometry students should be able to find out those things. Fifth one, most important one, communication skills and informed consent. This is where we are lacking now. I think effective communication is a central to patient safety. Clear explanation of diagnosis, management options, and risks. There should be a shared decision making and documentation should be done. And communication during near miss disclosures or during adverse events, that has to be properly communicated to the patient and the patient party. Sixth, ethical and legal dimensions of patient safety. I think we have to make sure that the professional accountability is taken care of. Why? Because we as an optometrist should be knowing what are the medical legal implications of an unsafe care. So we should be very aware of it. Documentation standards and record keeping should be done for a legal defense if in case some issues occur. And there should be an ethical management of errors, including transparency and duty of care. Seventhly, it's very important one where interprofessional collaborations are required, where as an optometry, along with the team of ophthalmologists and the staff nurse, we all come together and provide the patient-centered approach. And there should be a structured referral protocols. Collaborative care case discussion should happen on a very continuous basis with the ophthalmologist. So we should go hand in hand with the ophthalmology fraternity, and we should understand the continuity of the care and do perform the follow-ups. Eighth one, as I mentioned before, simulation-based patient safety training should be done. This should be incorporated in our preclinical training, where most of our optometry institutions, they do it now. For example, some OSCE scenarios or grand rounds, or maybe simulation-based patient care, where patients are asked to simulate some kind of a conditions, or students are specifically asked to simulate some kind of conditions, and our students and our trainees are being trained and how to deal with those kind of issues. Provision of some kind of case minutes and reflective debriefing. I think this kind of experiential learning will really give kind of a readiness for our optometry fraternity students. Ninthly, safety culture and quality improvement. So this should be a long-term, lifelong kind of improvement, lifelong kind of a learning. Basics of clinical audit should be taught to our students, reporting systems for errors and near misses, which Dr. Zamina also mentioned about now. And it should be a kind of a learning where it should be a non-punitive kind of an atmosphere, where our optometrists or the optometry students or the fraternity will be happy enough or safe enough to convey that there was a near miss of such and such issue for this particular patient. Now, what are the expected outcomes of doing all this, of incorporating safety into the optometry curriculum? There will be an improved diagnostic accuracy. There will be a safer clinical practice by the graduates. There will be very strong professional accountability and ethics. And overall, there will be a reduced preventable harm when it comes to the vision. So, the key takeaways of this small presentation are: patient safety is foundational, it is not an optional one. Optometry education must evolve with clinical complexity. Early structured exposure, it builds lifelong safety habits, and culture change begins in the training institutions. So as a training institutions, when we incorporate this kind of things, I think that's where the change actually happens. So thank you for your patient listening.
Thank you, Mr. Avinash. Next, I would request Dr. Rajiv to start the presentation. But before that, I would like to introduce Dr. Rajiv Prasad is the President-elect for the World Council of Optometry, President of Asia Pacific Council of Optometry, Secretary General of the Indian Optometric Association, founding President, International Academy of Myopia Control, founding board member of Global Optometry Public Health Alliance, founder and director of Visual Eyes India, senior clinical optometrist, and founder of Eye Gurukul. Over to you, Dr. Rajiv.
So, thank you so much, Leena. I think this is a great. I would say one of the thing which everybody wanted to, let us have this collaboration, and this collaboration is really between ophthalmology and optometry is really essential to ensure that safe, efficient, and patient-centered eye care in the face of growing burden of avoidable blindness, and where the care is, delivered in silos, delays, and in detection. And these gaps in communication and unclear referral pathways can compromise patient safety. And that is what we all are really concerned about, that patient safety should be taken on priority. And optometrists often serve as a first point of contact, while ophthalmologists provide advanced medical and surgical care. And when these role of aligned mutual, respect and structured collaboration comes, patient benefits from the early diagnosis and timely referral, continuity in care, and better outcome. And this strengthening the partnership, I would say, in many ways. So the four primary players in collaborative care, the ophthalmic surgeon, the independent community optometrist, which provides the primary eye care, the patient, and the house. Am I audible clearly? Like
Yes,
somehow.
Rajiv ji, you're audible.
Okay, because somehow I see that things are not moving,
No, you are
or
very
maybe.
audible. Yeah.
Okay, perfect. So, and the in-house partner optometrist who functions alongside with the surgeon. And why it is really important that the collaboration matters is, there is, I think Dr. Samina really shared things in a beautiful way, that and role of optometrists. But the rising burden of myopia, corneal diseases, the surface disorders, increasing patient load, and complexity and need of continuum of care and not fragmented care. And that is what is really needed in a country like India, which the population is like flooding, and patient benefits when ophthalmology and optometry work as a team. So moving forward, the existing challenges what we see is the role of ambiguity, and at times there's like crossroads. There are definitely, what I personally see in my almost more than 2 decades of practice, that there's a kind of communication gap, which is really important to cover. Training expectation mismatches there probably to a certain extent, and parallel practice models. I think this is very important with we will have to really see that how this works, because there are things which is crossing, and we'll have to make sure that we really do it in a proper way. And Dr. Samina really emphasized on and hearing this ma'am, from you as an ophthalmologist coming to an optometrist, very nicely you have defined the role of optometry. And our shared vision is all about integrated eye care delivery, we all as clinicians wanted that we should give the best to our patients. A very clear role definition, definitely mutual respect and trust, and on top, it has to be a patient-centric care. The key area of collaborations, what everybody looks at is the clinical care, the cross referrals between ophthalmologists and optometrists. These days, I think most of the conferences what we see in India or abroad, there are sessions with optometry and ophthalmology together, and that is fantastic one. And this platform of international eye care alliance, when initially me and myself, Avinash, Dr. Samina, and we all discussed about, I think we really discussed that this is the time that we should come forward, join hands together, and work together in terms of education, training, collaborative research, which is already happening in many places, evidence generation, and definitely advocacy and policy. The clinical collaboration is in a very, I would say, structured way of referrals, where like patients who needs low vision services, that goes to a low vision department, where other care are needed, and where surgical intervention or medical intervention is needed, the optometrist should ideally refer it to ophthalmologist rather than just thinking more about it. It can be co-managed. It is, all the chronic diseases can be really co-managed in a decent way, and we have to have that shared clinical protocols, and definitely we are moving towards more of multidisciplinary case discussions. We can future with ICA. I mean, we can work on joint CMEs, workshops, interprofessional learning, clinical exposure, and mentorship. Probably faculty exchange program. I think that would be a great thing to move forward and learn from each other. And at association level, I mean, we can have a joint committees, a kind of task force who can work on all of these things, a consensus guidelines, SOPs. If we can do it together, I think that will be fantastic. A public awareness, where we have 1.45 billion population, and the number of eye professionals, number of ophthalmists or optometrists are really less. We really need to move forward, and we need to create awareness, especially these days what is happening is people go to optical shop, the person who is sitting there doing refraction, he's not professionally trained. So this kind of public awareness is needed, that they should go to a proper eye care professional. They should go to an optometrist and ophthalmologist for their eye examination, rather than just going to an optical shop, getting it done, and probably they end up in having different problem. So there's this platform which is created, and there's the first webinar we are doing on this. So it is International Eye Care Alliance, and I would really say that the future of such kind of programs is really, really important. We have to work together, and the way forward is really about having a dialogue, a trust on each other, collaboration. We can work on pilot integrated care models. We can scale successful partnerships. We can have those success stories to share, and definitely together we have to work on strengthening eye care in India. So thank you so much from my side, but I would say, this is, thank you, Dr. Samina, for, initiating this. And I believe this is first of its kind. And in future, definitely we are looking forward for more and more, such collaboration together. Thank you so much.
Yeah, thank you, Dr. Rajiv. Now over to Dr. Samina.
Thank you, Dr. Rajiv and Avinash ji. It was really wonderful listening to the both of you. And now I am very honored to welcome Dr. Pradnya Sriram, who is a dear friend, and she's also very vocal about what she stands for, and she stands for the cause of eliminating avoidable blindness through safety. She wants to keep our patients safe while they are taking eye care. So let me introduce Dr. Pradnya. Dr. Pradnya is an ophthalmic anesthesiologist. She has been a consultant at Shankar Netralaya, Chennai, and has 31 years of experience in ophthalmic anesthesia. She's associated with the Seva Foundation and is involved in training for medical emergencies and quality eye care. Yes, Namrata madam, you'll join now? Yes, yes, surely. Surely, surely. So Dr. Namrata Sharma will join us after the panel discussion with Dr. Pradnya. If Dr. Mohita Sharma is here, I would like to introduce Dr. Mohita Sharma also. Okay. So Dr. Pradnya, can you hear me? Are you here? Just give me a second. Till the time Dr. Pradnya joins us, I had a question for Avinashji. Avinashji, can you hear me? Are you here? Can you please on your
Yes, ma'am.
video?
Yes. Tell me.
Yeah, thank you. Avinashji, I had a question for you. You are a part of a very esteemed healthcare organization, and you've been a teacher for many years now. In your experience, from the days when you were a student of optometry to now, wherein which there's a kind of a huge change in the way optometry is taught, optometry is practiced, and the scope of work of optometry in a country like India, where the population demands that all of us join hands in this work. What do you think? What is the change already? What you're seeing, and what you would, what is the message? Your message for the optometrist over here?
Yeah. It's a very important question. And way back around 15 years back, when I was doing my undergraduation and later after that post graduation, the kind of syllabus that was taught to us was it was working in xylos. It was very specific to the some of the core optometry topics like say refraction, contact lenses, binocular vision, and a little bit of low vision here and there. So it was more like very specific to the domain of optometry, and it was more working in xylos. But over the period of time, now as I did a transition from a student life to as a faculty now I find that few of our curriculums, they are kind of professing more towards an interprofessional kind of a practice, where there should be a combination of say two or three professions come together. And when it comes to a patient centric approach, it is no more alone optometry, but it is a combination of optometry, ophthalmology, the nursing community, the public health community on one side, and most importantly the research section has come up it has evolved over a period of time, say the past 15 years, where the role of optometry also has taken up a very pivotal role. So, considering the global blindness burden that we are currently battling out in India and as well as across the globe, I think the current optometry fraternity or the institutions teaching optometry, they are more focused on giving a comprehensive teamwork based kind of an approach rather than very specifically a xylo based optometry approach. So this is a kind of transition that I have seen for the past 15 years. And the students that we do train now in our clinical practices also, we make sure that they mingle, we make sure that they work as teams with other professions and give the best for the patient.
Right. So this was very useful, Avinashi, and thank you for answering that question. Dr. Rajiv, I believe that you're going to take an international role very soon in the world of optometry. Tell us more about it, and also tell us what is the difference you see in the optometrist outside India and the optometrist in India. And if there is something which we can learn from the optometry training, the optometry practice, and empower our optometrists. So what is your take on that?
I think very, very valid and important question. See, what is in global scenario, what is happening is, uh, you know, like I'll get you an example. Recently, I was invited to speak at World Congress of Pediatric Ophthalmology and Strabismus at Malaysia last year, I mean, during conference. And I see there a full session, with a panel of optometrists who are speaking at those forums. So internationally, if I talk about, let it be Europe, let it be US, let it be any other places, I've seen that a lot of sessions where, especially the domain where low vision, contact lenses, ortho case, scleral lenses, or say, there are various specialty, oculoplasty, where ocularists are involved. So all those sessions are there at each and every ophthalmic conferences. Since last 3 years, I have been going to Emirate Society of Ophthalmology in UAE, doing sessions on neuro-optometry, and latest innovation in low vision. So it has started going in hand in hand. I mean, since long there has been differences in different ways. Probably the only reason is the role of optometrists has not been defined properly. I mean, and the kind of transition which is happening, when I did optometry over 25 years back, I mean, I see it was treated more as a refractionist, and it was more of diploma then. But a big major transition has happened, and especially the world is looking at Asia, the world is looking at India. I mean, two major countries which back the maximum avoidable blindness, that is in Asia. Myopia, which is on the top, the major chunk is in Asia. Let it be Singapore, Taiwan, China, Korea, India. I mean, it's booming like anything. Even though WHO has says by 2050, every second person will be myopic. The fact is, high myopia, which has been said as 9.8%, I think it is going to almost 15%. Because nowadays, every then and now, you see a patient, a child of 5, 6 years having -6, -7. Imagine when their next generation comes, they'll be all high myopic. So, there's a here goes with collaboration, and everybody has a bit role to play in a big way, and everybody has to be responsible actually. When we talk about our roles to work on, everybody takes the responsibility not towards our own fraternity, but we also take responsibility towards the patient whom we are serving, to be ethical. I think that is another piece which at times things are gradually missing and changing. But I think that even the optometrist has to be really ethical, and we should our group of people should understand that we should not cross borders. I mean, to be very honest, that is being happening. I have seen a couple of places, and I think that's a wrong approach, I would say. As an optometrist, and as a heading Indian Optometric Association or Asia Pacific. But globally, it is a collaborative approach. If we really, the numbers 2.2 billion we talk about internationally, that billions who are visually impaired, and 80% is we can avoidable. I think important is, when we talk about avoidable, it always goes hand in hand, that avoidable can only be done when we are aware what role we have to play, how we have to work together collaboratively, how we can join hands, how we can support each other. you know Without supporting each other, nothing is going to move forward. I mean, I since I work more on arena of low vision, when I see people, like, just a good refraction or a good advice on filters changes their quality of life, right? So I think that awareness is needed, and thankfully, recently, AIOS also did. I was invited to do a prayogshala at AIOS building, and I'm really happy to see that such specialty is being really considered as one in mainstream, and the amount of ophthalmologists who came down to listen low vision, that was phenomenal. I mean, I've never seen a group of 30, 40, 50 ophthalmologists coming for low vision session, because low vision has always been seen as one of the last kind of department. But I think the future is we have to work in collaboration, and I think this is a great start, ma'am. This is a
Thank you,
great start.
Rajiv ji. We are very inspired by what you have shared. And I'm very glad to tell you that Dr. Mohita Sharma has joined us now.
Fantastic.
Dr. Mohita, if you can please on your video, we'll be
Yes,
able to
any
see you.
talk to now. I wait by.
Yes.
My video
So,
is on now.
yes,
I
fantastic. So,
think
Dr. Mohita Sharma is the General Secretary of the Women Ophthalmologists Society of India. Women Ophthalmologists Society is her brainchild, and she's also the General Secretary of the Women Ophthalmologists worldwide. And as we all acknowledge, majority of ophthalmologists in India and across the globe are women ophthalmologists. So her presence here is very significant for us. And thank you very much, Dr. Mohita, for joining us. She's also the founder and the chief medical director at Tirupati Eye Hospital in Noida, Delhi. Dr. Mohita, I have a question for you. Today, we have been talking about this International Eye Care Alliance, a collaboration between ophthalmologists and optometrists globally. And there has been discussions about how there is a need for this collaboration and how together as a team we can eliminate avoidable blindness. So what is your take on it? And we will be glad to listen to you now.
so. Thank you, Samina, and I'm very happy to be here for this first meeting of a proposed alliance, which is actually going to make a lot of difference in the way which we treat our patients, and to have you here in this webinar is one of the best things because you are one of the best persons who believes in a lot of collaborations, and along with you I can see Dr. Rajiv Prasad, another person who believes in a lot of collaborations. And whenever such people get together, then good things always happen. Now, first and foremost, I apologize for being a little delayed because there was some network issues. Thank you, Dr. Rajiv, for helping me out with that. Now, I heard the last part of the discussion where I feel there was a discussion. The discussion that was happening on collaboration between ophthalmologists and optometrists is very relevant. Uh, Okay. So, in fact, as Dr. Rajiv was saying, that if we know our boundaries as ophthalmologists and boundaries as optometrists, then this collaboration will never have any conflict, and this collaboration is going to be complementary. So, now this is very important because there is enough work for ophthalmologists, enough work for optometrists. In fact, if we see what ophthalmology or optometry was around 15 years back, there is a sea change in both, and the sea change is such that the kind of work that we do now compared to what we were doing 15-20 years back is absolutely different. Now, I'm sure optometrists, what we have been seeing, that optometry has developed so rapidly that over the years, is the voice clear or is it echoing a little
There is
bit?
some echo, Dr. Mohita.
Yeah. Yeah, so it has changed so drastically, and so has ophthalmology. And today, when we see the ophthalmology setups, I can tell you one thing, that ophthalmologists cannot survive without optometrists in their setups. Now, if you see optometry setups, they can function independently, but it is not that they cannot survive without ophthalmologists. So ophthalmologists are the ones who are in dire need for association with optometrists, because there are so many things which have come up, as you were saying, whether it was low vision aids or it was orthoptics. You will always find that when you announce a session which is related to low vision aids or to orthoptics, even if ophthalmologists may not do it themselves, they want to know about it, because if they don't know about it, what will they counsel their patients? What are the patients? How will they select their patients, and how will the patients benefit? Similarly, I feel there are so many ophthalmology conferences happening all over the country and all over the world, but we don't see a synergy between ophthalmology and optometry. We don't find that there are significant sessions of optometry in ophthalmology conferences, which is, I think, a lacuna in our conferences. Now, because of this lacuna, we do not exchange knowledge with each other. And that is where we kind of fall back in our knowledge. And Dr. Samina, you would agree that we keep talking about cataract, cataract, cataract. Sometimes we talk about glaucoma, and that's it. But where we talk of common things which are more common in our OPDs, and we don't know much about. So if this if we it's high time that we got together, the optometrists and ophthalmologists, and we know there should be significant number of conferences, where in fact all conferences should have if it's an ophthalmology conference, there should be at least 30% sessions of optometry and vice versa. Then only we will interact, we would meet, we would exchange knowledge, and we would develop collaborative things. So I think first and foremost, Amina, this is an area where we need to work on, whether it is AIOS or it is WAS. As ophthalmologists, this is the change that we can bring about. And simultaneously with Dr. Rajiv there and others there, sorry, I don't know all of them as of now,
Yes,
but,
yes.
but with all of you there, we could be a part of your conferences. So that would be the first step towards exchange of knowledge. And or even if it's not very large conferences, even smaller CMEs, there has to be a mix of the two super specialities. So that is what I feel, and that is the lacuna that I see everywhere.
So it's wonderful, Dr. Mohita, to hear this from you. And I can assure all the optometrists and everybody who has joined here that if Dr. Mohita has said this, definitely in the next Women Ophthalmologist Society, she will see that there is a session which is pertaining to optometry, the nuances of optometry, like the neuro of the optometry, and low vision aids and all those things. That we can have a parallel track running over there, and a lot of you who would like to join, I'm sure that we will come out with something. And thank you so much, Dr. Mohita. This is very inspiring. Thanks a lot. And as Dr. Mohita said, Avinash ji and Dr. Rajiv, as optometry groups also, you should invite ophthalmologists. And at least, so we are also very keen on coming and talking to all of you. That dialogue, a dialogue is always, any ideas can emerge only with a dialogue. And this International Eye Care Alliance is exactly doing that same. It is kind of stirring a dialogue between these important pillars of eye care. So thank you very much, Dr. Mohita. And if you can just stay back for some more time.
I'm there.
Okay, thank you. Yeah, thanks. Dr. Pradnya Sriram is with us. Dr. Pradnya is, a kind of another safety champion, I would call her that. She's a senior anesthetist. And Dr. Pradnya, we cannot see your video. It's okay, but you can hear us. Can you hear me now?
Yeah, I can hear you. I'm so sorry. There is some problem with the video
fine.
connection.
That's fine. It's okay. You're here with us. That's very important. I wanted to ask you that as working as an anesthetist, an ophthalmic anesthetist for more than 30 years, first in Shankar Netralaya and then now at Pradnya Netralaya in Bangalore, what is your take? Do you think that our optometrists can be empowered to ensure the safety of our patients? Or do you think that they can be trained in handling common medical emergencies in eye care, or in ensuring safety in medication, medication management, all the drops and all those things, all those kind of things? Do you think that optometrists can take a leadership here?
Yes, I do think, and I think, as you said, Samina, and thank you for inviting me for this discussion. I think optometrists play a huge role in an ophthalmic setting, and so they should be empowered in every aspect, not only in helping the ophthalmologist, but when we are talking about patient safety, there are certain things which can happen during when the patient is with the optometrist. Like you said, where I think Dr. Rajiv and Dr. Avinash, everybody spoke about it. So one common medical emergencies which is very common is when the contact lens fitting is done, the patient can just have a vasovagal syncope. So there are some very common some emergencies which happen particularly in an ophthalmic setup, and the first contact with the patient is the optometrist. So I think the optometrist should be trained in these to handle these medical emergencies, and they can play a huge role because they would be the first responders in this scenario. And I do not know whether the curriculum includes teaching them about medical emergencies. So the common, as I have trained in your hospital, my hospital, and other places also in ophthalmic conferences, I feel there are very you can count on your fingers, and if you can empower them and train them, the optometrists, to handle these medical emergencies, they can be really of great help because they would be the first responders in such a scenario.
Fantastic, Doctor. So I think my voice is echoing. Maybe you can just mute yourself. See, Dr. Pradnya, what she's trying to tell us that our optometrists should be empowered to identify the early warning signs of a medical emergency, right? And Avinash, there is this question for you. Do you think that the curriculum of an optometrist, common medical emergencies in eye care, are they taught as a part of the curriculum?
There are few bits and pieces when it comes to a subject called as an ocular disease. We have got a small portion on ocular emergencies like CRAO or retinal detachment or say open angle closure glaucoma, but there is no specific a kind of a module wherein we do teach our optometrists about this. So it's very rightly brought out by Ms. Pritnya on this. I think yes, we are lacking somewhere in our teaching, and this actually opens up for a kind of a workshop or maybe some small seminars or hands-on training sessions, wherein I think the optometry students should get involved and be learnt about this.
Fantastic.
So,
I think,
yeah.
Dr. Pradnya,
so,
yes.
Yeah. So, as you rightly said, that because I feel the optometrists would be the first responders in any emergency, and I'll give you a small example. Even if they identify that there is an emergency, they may not treat it, but to identify that there is an emergency and call for help, call for code blue. That is when this one that would save a patient's life. I'll give you a small example. During the COVID time, we had a patient, 40-year-old, who came to our hospital, and they were in so much of stress and they're working from home and they're all the time in this. So when the optometrist saw the patient, and because in Samina's place, my place, we are continuously doing this training. The optometrist noticed that the patient was not normal. He didn't look normal. He was a young 40-year who was there, and she immediately called for the call for code blue and put the pulse oximeter on the hand. Now she found that the pulse rate was at 180 on the pulse oximeter, so she called for code blue, and then we responded. So I responded to that. We came there, and the patient was actually going into something called SVT, supraventricular tachycardia. So since I was there, I could just respond immediately, do a simple procedure called carotid massage, which got the pulse rate down from 180 to 150. And then we of course had shifted, and since I was there, I could do some IV intervention and give Xylocard and all that. That is a different issue. But what I want to emphasize is that the optometrist identified that there was something wrong with this patient, called for code blue, put a pulse oximeter, which is the simplest thing which you can do, which will tell you that there is something wrong. And beyond that, they didn't do anything. But then, we could save this patient's life, because SVT, supraventricular tachycardia, can lead to ventricular tachycardia and cardiac arrest. So, Samina knows how passionate or how important it is to identify these things, and we have been doing this. I think in Samina's place also, they are very well empowered, and they have saved a lot of patients in the OPD. So that is what I wanted to tell.
Thank you. Thank you, Dr. Pradnya. I think These kind of dialogues are very interesting because here she is full of knowledge to share, and here we have a healthcare organization, a prestigious healthcare organization like RAMAIAH, who would be happy to maybe take her expertise because she's a teacher in
Mm,
this.
mm.
And you can have a small workshop called Dr.
Yes.
Prajna, speak about
Yes.
this. Besides this, of course, you know that I'm a person in quality, so we can even talk to them about key performance indicators, the role of kind of improving or enhancing the patient's
Yeah.
experience at an eye care organization by taking care of certain things at the eye hospital. So, how quality
Wonderful.
eye care, how reducing adverse events, how reporting adverse events, how analyzing adverse events, root cause analysis of adverse events. This is something which we can do together. So we have I'm actually, Leena is creating a group of all the people, a WhatsApp group of all the people who have registered for this webinar
Good.
today. And
Mm.
we will be sharing all informative material which are pertaining to optometrists and ophthalmologists on the group. A very beautiful guide on adverse event reporting is available. It was made with the collaboration with Seva Foundation, and we will share it in the group so that you can so that all the optometrists who are here, they learn how to do the root cause analysis when there is an adverse event which happens. So yes, Dr. Namrata madam is trying to join us, but unfortunately there is a technical glitch and she's finding it difficult to join here. Anybody else has any comments?
Yeah,
Mohita, would you like to say something? Yes. Or yeah.
there's a question in the chat box, if I can.
Yeah, surely, of course.
Yeah, Mr. Manish Bhagat has said public awareness of the role of optometrists remains limited in India. How can the profession work collectively to improve public understanding and respect for the scope and importance of optometry?
Yeah, I think Rajiv ji, you go first, and then I'll request Mohita to answer that question.
I would say, in terms of when we talk about collaboration, it is really important that, the first thing is all about that how we can work together. And as I said during my talk, that it is very important even for optometrists to understand what are their boundaries. At times, trying encroaching, I think that creates a lot of confusion, and that creates a lot of ambiguity. So I think the professional as optometrists, I think this WhatsApp group which Lena is creating, and where we can share that what and all things one should do and what should ideally refer to the right specialist, so that that goes to an ophthalmologist for the further care. I think that is where the respect for each other will definitely come forward. And then, I mean, beside what I see is every individual has their own piece of cake to take it forward. I mean, the moment we understand that, I think it becomes very, very easy. And definitely, in terms of public awareness, it is really required. As I said, the way mushrooming of things are happening, it is not only for ophthalmology or optometry, I think even for the sake of quality eye health of the public is important, that where they should go. I think with IACA International Alliance, we should work on creating this awareness that whom a general public should also go for their eye checkup. It is not usually, there were days that going to an optical shop was a good option, and that was okay, but I think it is high time that people need to understand that where they have to go. These days at WHO Specs 2030 also, we are talking about accessible eye care, affordable eye care, and available eye care. The only biggest piece which I feel is missing is when we talk about giving, say, just ready readers, what we are missing out that, maybe the patient may have suspect glaucoma, maybe the patient have some other problem. And just by getting a pair of glasses, they get into a comfort zone and they don't feel like going for an eye examination. So even the optometry at optometry level, I think it is important that they understand that what needs to be done, and ideally the case has to be referred to an ophthalmologist for the further intervention. Yeah.
So, yes, Mohita, would you like to answer what Mr. Manish Bhagat is asking that how do you create public awareness about the very important role of optometrists in eye care, and how do you enhance the respect for optometrists in the society at large?
So, Samina, I feel that now that we are thinking of this alliance, uh, there should be the best form of the best platform today for creating any awareness is social media platform. So if we can come together on a social media platform and spread the right kind of a message, and it should always not be whenever anybody on social media talks about anything, says somebody talks about a routine eye checkup, they will say, this is a routine eye checkup and come to me and I'll do this and I'll do that. It should always be that the right information, if an alliance can bring about a right information about when to go where, and together if we can do it, that would be the best. And for example, something like a routine eye checkup. Now, for somebody, the routine eye checkup may be just a checking of the vision and the glasses. For, as you just said, as Dr. Rajiv just said, for another person, routine eye checkup may include something like checkup of eye pressure, or maybe checkup for an eye for a basic checkup for a dry eye, etc. So first and foremost, we need to define what is a routine eye checkup, or what is an eye checkup when there is a problem, and then where the patient can go. They have the option to go to an optometrist, they have an option to go to an ophthalmologist, and do they have an option to go to just an optician and get their glasses changed? So that difference, till date, our public does not understand the difference between an optician and an optometrist and an ophthalmologist. They don't understand the difference, and they don't understand the roles of each. So somewhere, if we all together can clarify these roles, the public would know better. If we say that you go to an optometrist and get your eye checkup done, they may get confused, and they may feel they have to go to a optical shop and get it done. So what is an optometrist is still not clear in our public's mind. So we have to bring them to, as the question has been asked, that to public needs to realize that this is a very good resource which they have available, and a very respectful profession. Now, Dr. Rajiv, you would agree with me that half the people don't know what an optometrist is?
Ma'am, I
Half,
would say half of,
90%
I
people
would
don't
say
even know what is
90%.
an ophthalmologist. They only know eye surgeon. They only know what is an eye surgeon. So how would they know what is an optometrist?
Ma'am, frankly, it's been 28 years in practice, and what I see is optometrists are seen more as an opticians. And I won't
Yes.
blame it. I won't blame it to public because optometrists are more towards dispensing. Even they have also not probably been trained during their college days that what are the specialties they should ideally get into. So they are limited to doing refraction, and they're limited to doing soft contact lenses. And very few, not even probably 10% of the country optometrists are actually getting into low vision or specialty lenses or binocular vision. And that is where the optometrist needs to be trained actually more on that.
So,
So I
Rajiv,
think
there is a
that would
question.
come
Yes,
with the trainings
Yeah.
also,
Yeah.
more with the trainings.
absolutely.
There's another question from an optometrist, Sumaya. She says also there are standard differences between Bachelor of Paramedical Technology, optometry, and V optometry. Is both same, both called optometrists. I'm facing issues as I am a BPMT optometrist.
Okay, probably I can
Avinash ji
help.
can take that question, I
Yeah,
think. Yeah.
so Avinash.
Yeah, no, I think these two are the total different entities. Now, when it means B optometry, it is a 4-year program where 3 year is your formative years, and the fourth year is it's a pure internship period of time. So 3 plus 1, 4. So 3 plus 1 equal to 4. So this is called as an B optometry, and this is what the existing NCHP, the National Allied Health and Healthcare Professional, has come out with a curriculum of optometry. and this is in line with that. So the current one is proposed for 5 years as of now. So and I think, yeah, okay, if it's a 4-year program, then I think we need to see what are the different courses are being taken in this 4-year program, because as of now the standard structured and approved one is B optometry, that is bachelor's of optometry, and we don't have any parallel other kind of an optometry which has been accepted across India. I think maybe Rajiv sir, maybe you could be have some information on this as well.
Okay, so just to add on what Avinash you mentioned, when it comes to technology, so optometry is a healthcare professional as per accepted by NCHP and not a, technology course. And that is the reason when the first Shankaracharya started with BITS Pilani, which was a technological AICTE, and finally they changed it, and now it is no more BITS Pilani, and it is under the, that healthcare science. So uh, BPMT is basically, I would say, just like 3 years course, if I know it correctly, and it has to be as per accepted by the government of India in NCHP Act. It has to be a 4 years program at least, so that it has to go hand in hand. But definitely, I think still government has definitely come up with allied health bill. But I mean, how long will they take to implement it in a right way? I think that is a big question. So, and once that is implemented, I think this, all of these things is in air and it will take some time to get resolved. But I'm sure in coming years, 2 to 3 years, I think things will be very, very clear. Or if at all there is a gap of 3 years, 4 years, another thing, which is there. So probably I'm sure the government will come out with some kind of bridging things and how to upgrade the things. Another piece which I see is missing, is whether the person is a diploma in optometry or a bachelor's in optometry or master's in optometry. They are seen as an optometrist, but who can do what? That is a big question. I mean, that still is a missing piece, that who is eligible to do certain things, who is not eligible to do certain things, or who has been trained into, say, specialty. That is another piece which is which has to be clarified by the government, and we are working on that. Hopefully shortly in coming days we'll get those answers. So hope, Sumaya, I think me and Avinash, uh, it is clear to your question, and if you have further questions, feel free to ask us.
Yeah. So there are many questions about how do I do neurooptometry? How do I learn about prosthetic eyes? So I think young optometrists here are finding, want to know answers about how they can, upskill themselves and learn new things. So I would request all of you to please be very active on the WhatsApp group, which is going to be formed very shortly. And we will have your teachers and good guides. We have Avinash ji here, Dr. Rajiv here, who will guide you about what are the further courses or fellowships or observations you can take in reputed institutions across India to sharpen your skills or to learn new skills in optometry. Besides that, I am actually, because Mohita is here and Dr. Pradnya is here. She also runs Pradnya Netralaya in Bangalore. So we are planning of opening eye hospitals for optometrists to come and observe and learn. Something like observing, understanding, and then changing practices, so that you learn that how an optometrist, besides the core optometry, can also take leadership in other areas in an eye care organization, like patient safety, equipment maintenance, facility safety, quality, and all such things. So we are very happy to open our doors for observerships, and you can connect with Mrs. Leena Nair, who is here, right here. Her email ID and phone numbers are going to be shared with everybody. So you can connect and do come visit us. Similarly, I'm sure Dr. Mohita, who is here, who runs Tirupati Eye Hospital in Noida, will be happy to open her doors for all of you. And I think there is this question about discuss the role of an optometrist in ensuring patient safety and critically analyze the professional and clinical limitations of optometric practice with relevant examples. Yash is asking this question. So I think we already, Pradnya, would you like to answer Yash again? Do you think that role of optometrist in critical patient safety? Would you want to just quickly?
Yeah.
sum up
Yeah,
that.
so that's what I told you, that optometrists are the first responders in the ophthalmic hospital, eye hospital. So they should be empowered and trained in any medical emergency. So first thing is identification. So until unless they know what it is, they cannot treat the patient. So I think, and you do get critically ill patients. Most of our patients are geriatric patients who have a lot of comorbidities. So I think we can train the optometrists to identify what is wrong with this patient, and that would take us forward in the treatment process or whatever you say.
So, Pradnya, besides what you already said about safety in an eye care organization, but please remember that many optometrists here might be running their own optical units. And how do we empower them to take care of patient safety? So, here, what I think is that, see, if a patient comes to you and you're independently working in an optical unit, you still have a major role to play, because if a patient comes, his vision is less, and you cannot there are no refractive errors, or glasses are not helping this patient. You know that if the patient is diabetic, if the patient is hypertensive, if the patient has come to you with sudden loss of vision, these are systemic illnesses which you can help the patient guide to the correct places for ruling out systemic problems. So here again, your role is important, because the eyes are a part of the body, and if there is something which goes wrong in the body, the eyes are affected. So if you are aware about all the conditions which can cause vision loss, you can guide them correctly so that the patient remains safe, right? So I think that's another aspect of care for optometrists working as single units and not in eye care hospitals. Yash, I hope that we have answered your question. And if not, please unmute yourself and you can ask us more. But I think we should wrap up. Any final comments over here from any of the speakers or panelists?
Ma'am, just to
Otherwise,
add on, I think there were a few questions on, specialty, neuro and learning, ocularistry and all. So, friends, I mean, at any point, any specialty which you are, interested in, say, specialty contact lenses, ocular processes. So, I mean, my center in New Delhi, we are totally into specialty optometry practice. So just connect with us, and probably whether it is neuro optometry or sclerals or ortho K, myopia management, you know, uh, low vision therapy, will be more than happy to help you out, even including processes. So
okay,
we,
so there you go. Yes. Avinash ji, are there any training options available at your institutions? Any fellowship options where people can come and learn?
No, ma'am. As of now, we don't have because we started optometry just on around 2019, 2020. So we are in a planning stage of getting all those things. But I think we can collaborate with you since we are closer to Zamindar. And I think we can plan for this kind of initiatives. It's a very wonderful question asked by a few of our young optometrists over here. I think we can think about this as well in the long run. We can do that.
Okay. And I'm so glad to tell all of you that finally Dr. Namrata Sharma madam is able to join us. Very welcome, Namrata ma'am. Thank you so much. She's a very busy person, as we all know. She's a chairman, scientific committee, All India Ophthalmic Society, and a leading cornea and cataract surgeon at All India Institute of Medical Sciences. Namrata madam, can you unmute and give some comments about this collaboration between ophthalmologists and optometrists, and about the International Eye Care Alliance? Ma'am, please tell us how AIOS can help this make this collaboration stronger. There were some comments that in ophthalmic conferences in India, unlike conferences abroad, we don't have a parallel track for optometrists. So, ma'am, we are all very eager to listen to you.
So I
yeah.
think you are quite right, and this I have always felt whenever you go to the international conferences like ASCRS or ESCRS, they have a special section like ASCRS has ISWA, ASOA. So they have a special section for optometry people, and I think that is which is also required in India, which unfortunately we don't have. But I think it should be there because optometrists are an integral part of ophthalmology and also the ophthalmic care. In fact, you would agree with me that if they are not there, we cannot function because we are virtually paralyzed because they are the ones, who actually do everything, and we then only act on what they tell us. And some of the skills that they acquire and some of the things that they do, I mean, they are the experts at it. We cannot even try to do it. So I think India has come a long way now as far as the international ophthalmology is concerned. We had APO last year here, Asia Pacific Academy of Ophthalmology, and it is time now that the optometry, although I know that in some of the conferences, small conferences or state conferences, the optometrists are an integral part, but doesn't happen at the All India Ophthalmological Society level. So I think that is something that is required, and I would like to congratulate you for this collaboration, Samina. You always come out of the always come out with ideas out of the box. You took forward the quality control of the surgical procedures and the hospitals in India, and you were the torchbearer for that. And I think this is yet another thing which people don't pay attention to and which is really required. And again, I feel it will change the landscape of ophthalmology if we move into a more inclusive and have a more collaborative approach rather than, each or to oneself or herself or himself.
So very well said, ma'am. We all have a very limited time on this earth. And in this, our journey, if we can help as many people, and if we can work together, then we can definitely, have this very lofty ambition of eliminating avoidable blindness. I feel the importance of preventive eye checkups, which is still missing in all strata of the society. I feel that when optometrists are take this leadership, besides ophthalmologists, because the strength of optometrists is much more than ophthalmologists in India. If they take up the leadership to become the community vision leaders and encouraging people to come forward for preventive eye checkups, learn how to do the screening, and and we somehow can equip them with fundus cameras, with non-contact tonometers, and they can detect these avoidable blindness early. I think this is the way forward. So I really feel, ma'am, that what do you think? What do you think if somehow the ophthalmic, our industry can come out and not just supporting ophthalmologists, but supporting optometrists also, empowering them so that they can diagnose avoidable blindness much more faster and direct these patients for appropriate care.
Oh, I completely agree with you. As far as the numbers of optometrists are concerned, we are not there. And there are so many causes of blindness which are preventable, the screening procedures, etc. And I think they can do it the best. And like I said, we require a lot more optometrists as compared to what we have now. I think we have close to 18,000 optometrists now, and we require about 48,000, which is a large number. In terms of ophthalmologists, I think we are almost nearly there, but in terms of optometrists, we are not there at all. And we try to do things which we are not supposed to do. So I think the way to go would be to empower them, uh, to partner with them, and to proactively see that, their knowledge and their skills are also as updated and as upgraded as ours are. I think more so in India. I don't see that internationally, but I think more so in India because we tend to, both the stratas, they tend to kind of segregate and don't work in collaboration with each other.
Yeah, exactly. I think when sort of when a person goes to an optometrist, that person should be guided that a complete eye care has to complete with an ophthalmologist, right? And similarly, when a person goes to an ophthalmologist, the due respect and credit for the role of optometrists has to be highlighted. Because one of the questions, Dr. Namrata, in your absence, somebody asked that how do we create awareness in the public about the role of optometrists? How do we ensure that there is enough respect for optometrists also in the community? There is definitely the need for optometrists. There is a role to be played, but somewhere along the line, do you think that there is enough respect for optometrists in our country?
I think as far as that is concerned, we ophthalmologists only have to take the responsibility for that, because the optometrist, it should be made aware to all the to the public, in fact, that they are the first contacts, or they are the primary contacts, and we are the secondary contacts. So it is our responsibility, I think, to make the general public aware about their very crucial role as far as the prevention of reversible blindness is concerned. More so because refractive error is the second commonest cause of visual impairment in our country. So we have to take that responsibility on us to, highlight the role of the optometrists in the society.
Thank you, ma'am. Thank you so much. And I think we have already overshot our time. So thanks a lot for your time. Thank you, Dr. Namrata, ma'am. Thank you, Dr. Mohita. Thank you, Avinash ji. Thank you, Dr. Rajiv. And thank you, Dr. Pradnya Sriram, for being with us. And thank you, dear participants, for joining us, for trusting us. And please do keep in touch with us, because here is this new dialogue which has been created between ophthalmologists and optometrists, and we will be meeting once in 2 months. But over to Leena for other housekeeping announcements. Leena, over to you.
Yeah. So thank you everyone once again. And of course, we all will be connected through our WhatsApp group, and we will keep updated with all the new initiatives we'll be having throughout the year. Yeah, thank you once again.
So, Sabina, I know it is a little, the notice is too short, but we are going to be having this AIOC at Jaipur. And so, in case you would want to take a session there, or Optometry Council of India would want to do something there, Dr. Rajiv is also here, then we would be happy to take it up. And maybe we can begin this year only, and then, expand our vision and our visualization both.
That is fantastic.
I can just say fantastic. I mean, believe me, this was right. I was about to say that AI is right here, and Jaipur is the right platform where we can initiate this, alliance. We can put it forward and let people know that this is the time. Things are moving forward. Let us join hands together to help, as much as we can. Just a small changes and correction, I would say. On record, yes. 18,000 optometrists are there, but we are just working on mapping the list of colleges and the number of optometrists getting produced. I mean, if I give you a rough number at this moment, I would say over 4 to 5,000 optometrists is coming out each year. I mean, that includes diploma, bachelor's, and master's. We are just working on that at Indian Optometric Association, and we are working along with Global Public Health Alliance. Very shortly, we'll be coming out with this data, and we'll be sharing that with you, ma'am.
Okay, good.
Thank you, ma'am. I think we will write to you, ma'am, about if you can give us a small, short session over there, and we can invite the optometrists also.
Yeah, done. Totally done.
Thank you. Thanks a lot.
Thank you so much.
Thank you.
This will be another feather in your cap, Samina. You've already taken the quality control to new heights, and this will be at another thing which begins today. Thank you.
Thank you, ma'am. Thank you. You've been very kind. Your support and Dr. Mohita's support is a huge thing, and thank you very much. We learn from you. That's the only thing I can say. Thank you once again, everybody. Thanks a lot.
Thank you.
Thank you.
Thank you.
Yeah.
Thank you.